Healthcare has always been critical to providing those in need with medical care and improving our health and lives. In the United States, however, getting hit with a few unexpected medical bills could mean taking on large debt or even becoming bankrupt. US healthcare has become notorious for its exceptionally high costs and relatively low quality. Today, only 90% of US citizens are covered by some form of healthcare. In contrast, 99 to 100% of people living in similarly developed nations have coverage. For the lower income bracket, the coverage provided by other countries far exceeds the quality of the US healthcare system. Despite this, the US consistently spends more on healthcare per capita than any other country. Last year, the US spent $9,403 per capita and 17.8% of its GDP on healthcare. Other countries, including Canada, Germany, and Australia, spent less than half per capita and 11.5% of their GDP on average. If the US spends so much more money on healthcare, what is hindering the system from being as successful? One massive perpetrator of rising healthcare costs are pharmaceutical companies and the extremely high pricing on drugs. Excessive drug prices are the single largest contributor to healthcare overspending in the US in comparison to other countries, as people seeking a particular drug in the US may have to spend up to 2 times the cost for the exact same drug in a different country. The US spent $1,443 per capita on drugs in 2018, but the average per capita spending of 11 other high-income countries came to only $749. These exorbitant drug prices have forced some people living in the US to choose between their financial stability or their personal health. A study published in the Journal of Clinical Oncology found that 13% of cancer patients would decline their approved chemotherapy drugs if they had a co-payment of $10 a month, while 67% of cancer patients would not pay for their prescribed chemotherapy if the cost exceeded $2,000. Another study found that 25% of diabetic patients underused their insulin due to costs. Why are drug prices so much higher in the US than in other countries? Countries in the US cite the costs of research and development as the primary beneficiaries of generated revenue. The exact figures for the costs of R&D are still murky, however. A 2016 cost report published by the Tufts Center for the Study of Drug Development, supported by large pharmaceutical companies, marked the price of researching, developing, and bringing one drug to market at $2.6 billion. The study faced severe criticism, however, as approximately 45% of that cost is distributed to investors and shareholders using an inflated interest rate of 10.5%, though the common practice typically dictates an interest rate of only 6%. This change would reduce the estimated cost by 25% overall. Furthermore, other factors that would reduce the cost of R&D, like federal tax credits for developers, were entirely omitted. Large pharma companies seem to back this study despite its flaws because it attempts to justify the large amount of revenue the companies bring in. Other studies disagree with the figures posed by Tufts, however. In 2017, a study published by the Journal of American Medical Association, or JAMA, Internal Medicine, reported a median cost for R&D at $648 million, with only 2 drugs exceeding $1 billion. This competing study pegs the cost of R&D at less than a third of the original estimate, and supports the claim that pharmaceutical companies in the US are inflating their prices to increase profits, not for funneling into R&D. Hank McKinnell, previous CEO of pharma company giant Pfizer, wrote, "How do we decide what to charge? It's basically the same as pricing a car. A number of factors go into the mix. These factors consider cost of business, competition, patent status, anticipated volume, and most important, our estimate of the income generated by sales of the product. It's the anticipated income stream, rather than repayment of sunk costs, that is the primary determinant of price." The problem is further exacerbated by the monopolies that pharma companies hold over potentially life-saving medicines and a lack of federal regulation. The US government provides patent protection and FDA exclusivity, which gives pharma companies monopolies over name brand drugs. Unlike other developed countries, the US government places no regulations on drug pricing, which allows them to remain high and bloats the price of healthcare for US citizens. Another major contributor to the high cost of healthcare overall is the ever-increasing price of US health insurance, which is one of the only for-profit insurance systems in the world. Despite employers partially covering the costs of insurance, the cost of insurance as a whole, and in turn, the burden placed on the individual, has continued to increase year by year. In 2000, for example, the average worker paid $1,500 for a family health insurance plan. By 2019, the average price is now $6,000. The total cost of a plan has nearly quadrupled from $5,800 to $20,600 since 2000. While other developed countries use some form of universal healthcare, most health insurance in the US is distributed by private companies that strive to make money. Universal healthcare is provided to all citizens by the federal government, regardless of the citizen's ability to pay. It assures quality health insurance and good coverages without placing a large financial burden on the people. The privatization of US healthcare field is directly responsible for financial burden being shifted to employers and employees. The cost of health insurance is also compounded by increasing prices of service and the default modus operandus of US healthcare. US healthcare practices defensive medicine. To protect themselves from potential lawsuits, hospitals and practitioners routinely order excess scans, checkups, and tests. Government programs like Medicare and Medicaid have also increased the demand for medical services, which, in tandem with overprescription, increases prices of everything across the board. For example, an MRI costs $1,420 in the US, but only $450 in the UK. Every scan and test is dramatically more expensive in the US, and routine overprescription quickly balloons the costs of healthcare for the average citizen. To make matters worse, these increased costs also increase the price of health insurance and the amount that people have to pay in premiums. These effects continuously compound on each other, meaning that the average US citizen has to pay much more than any other citizen in any other country. The US healthcare system is clearly filled with problems that inflate costs for the average citizen and especially harm the lower classes. We need reformation, but what reforms should be implemented? Leave your ideas in the comments section below. If you liked this video and want to see more, please consider subscribing for future content. And if you want to do some exploration into the US healthcare system and its problems, I've included links to the articles and studies I used in the description below. There are still a lot of issues that I didn't get the chance to touch on, but might be worth learning about. That's all for this video. Thank you for watching, and see you next time on InFacts.